now we're going to go over some tests for thoracic outlet syndrome. But again, there's lots of false positives with these tests, so you have to have a grouping of tests that are all positive to even start thinking that they might have thoracic outlet. In the lecture notes, you'll see that we have the functional test, or the 3-minute test. So you're going to hold your hands up here like this, and then you're going to open and close. And a positive test will be after I've done this for a period of time. If I have signs of thoracic outlet, this hand is going to start to slow down and it's going to drop because of fatigue and swelling in that arm. Okay, and then the next one, the Wright's test. So the next series of tests all use the radial pulse as an indicator of occlusion of that vascular system. So I'm going to find the radial pulse with my fingers, and then I'm going to bring him up into this position right here. And often these tests have variations where the patient will look towards their hand, and we see if there's a diminishing of the pulse, and then they'll look away as well. Okay, and then Allen's test will be here, again in those same positions to see if we're feeling a difference in the pulse. And then we'll go to the Addison's test, and I'm down into this position, and again he's going to look at his hand and feel the pulse. He's got it strong right there, so that's a negative sign. And then he's going to look away, and again we feel the pulse. Now each of these tests is looking at how the subclavian artery is coming out of this thoracic outlet. So the outlet, again, is going to be the rib here, and then we're going to have the anterior scalene and a posterior scalene. It's going to make a triangle here. And then that's the first triangle, and the brachial plexus and the subclavian artery are going to come out between that triangle, and then over here on the anterior side of the anterior scalene is where the subclavian vein will be located. And then the next triangle is down here with the spine of the scapula over to the acromion and to the clavicle here, and then the first rib. And so again, the brachial plexus and the artery and vein all have to travel underneath there. So check in the notes for the different causes of thoracic outlet syndrome, such as a cervical rib, depressed clavicle, those kind of things. So these tests are trying to replicate those dysfunctions. And then the last test is the Halsted's maneuver, costoclavicular. I'm going to bring his arm back into this position here. And again, see if I have a decrease in pulse.